BC youth experiences with vaping and nicotine pouches, findings from a youth-led study, presented by Lily, that's me, and Yoshida, members of the BC YAC. In 2020, the BC Ministry of Health commissioned McCreary Centre Society to carry out a study about the vaping experiences of youth in the context of the COVID-19 pandemic. An advisory committee of BC vaping experts oversaw the project, and 28 youth researchers were involved in co-developing and delivering the survey to their peers at three time points during the pandemic. Some of the youth researchers became founding members of the Minister of Health's Youth Advisory Council on Health and Wellness, or the BC YAC, that McCreary now coordinates. The BC YAC currently consists of 25 youth in grades 8 to 12 from urban and rural communities across BC who work on vaping-related projects, including supporting the work of the BC Ministries of Health and Education in this area. In consultation with experts in the field of vaping and nicotine pouches, we reviewed the 2020 vaping surveys, co-developed and piloted questions for the 2025 survey, and shared the survey link with our peers. The survey was available for 1 month for BC youth aged 12 to 19. We then had the opportunity to learn how to analyze the survey data using SPSS statistics, pulling together the findings, and are now working on youth-friendly dissemination materials to share the results. In total, 2,784 youth aged 12 to 19 in BC took part in the survey. They were most commonly 14 to 16 years old, and around half identified as female, 43% as male, and 5% as non-binary. They most commonly identified their family background as European, followed by Indigenous and East Asian. Youth from all five of BC's geographical regions were represented, including Vancouver Coastal, Vancouver Island, Fraser, Interior, and Northern BC. Among survey participants, 31% had ever vaped, 19% had smoked tobacco, for example, cigarettes, cigars, 11% had used nicotine pouches, a little over 2% had used a nicotine spray, and a little under 2% had used a nicotine bowl. Youth were more likely to have ever vaped than to have smoked tobacco and used nicotine pouches, and were more likely to have done so recently and regularly. Youth who used nicotine pouches, smoked tobacco, and or vaped were more likely to have also used nicotine sprays and bowls. 11% of youth had used nicotine pouches. Among these youth, 43% had used nicotine pouches in the past month, including 15% who used them every day. Non-binary youth were more likely to have used them recently. 46% got them from another youth, 32% from another adult, 27% bought them at a store, and 14% bought them online. 40% had used nicotine pouches while playing sports or exercising, though females were the least likely to have done so. Most youth, or 69%, reported at least one negative consequence from using nicotine pouches, and most commonly reported nausea, vomiting, and dizziness.
Now we'll be sharing the vaping specific results. 69% of youth had never vaped. More than 8 in 10 of these youth reported not vaping because they thought it would be bad for their health and they were not interested in vaping. As noted earlier, 31% of youth had ever vaped, with older youth being more likely than younger ones to have done so. Non-binary youth were the most likely to have vaped, and males were the least likely. The majority of youth who had vaped had done so in the past month, including a third who vaped every day. Youth who vaped most commonly reported that they most recently did so because their friends were doing it, and around a third because of the taste or flavor, and the same percentage were addicted. Younger youth were more likely than older ones to have vaped the last time because their friends were doing it and because they felt pressured into doing it or to fit in. Older youth were more likely to have vaped because they felt addicted to it and because they vaped instead of using cigarettes, nicotine pouches, or other substances. Youth who vaped on 20 or more days in the past month were more likely than those who vaped on fewer days to report vaping because they were addicted to it, for emotional reasons, and as a substitute for using cigarettes, nicotine pouches, or other substances. They were less likely to report vaping because their friends were doing it.
Youth who vaped most commonly got their vape supplies from another youth, and around a third got them from another adult. Older youth were more likely to get their vapes from a store, and younger ones were more likely to get them from another youth. There were no age differences in buying online. 75% of youth who vaped had stopped or reduced their vaping in the past year. Among these youth, their most common reason for doing so was concern about their health. There are no age differences in reported reasons for stopping or reducing vaping, except youth aged 18 to 19, who were 3 times as likely as younger youth to have shifted from vaping to using cigarettes. 15% of youth indicated reasons for stopping or reducing their vaping not among the list of options. These included peers or their partner wanting them to stop, their parents finding out, adding to their anxiety, and vaping affecting their ability to engage in physical activity. Most youth who had wanted to stop or reduce their vaping in the past year were successful. Youth who had vaped commonly identified that what would help or what had helped them to stop or reduce their vaping was feeling ready or motivated to do so, and spending less time around people who vaped. For 12% of youth, needing to be motivated was the only thing they indicated would help them or reduce to stop vaping, as indicated in the top quote. 14% of youth identified other supports that helped or would help to stop or reduce their vaping. For example, distracting themselves with physical activities and hobbies, and socializing with friends who did not vape.
When they wanted reliable information about vaping, around a quarter of youth reported going to family, though non binary youth were less likely to do so than males and females. Around 1 in 5 went to a friend or another youth. 9% of youth accessed social media for such information. Youth who vaped were more likely than those who had never vaped to seek out information from other youth and from social media. Around 3 in 10 youth had seen advertisements that promoted or sold vaping products on social media, most commonly on TikTok, Instagram, and Snapchat. Older youth were more likely than younger ones to have seen ads promoting vapes on social media, as were youth who vaped in the past month. More youth remembered seeing anti-vaping adverts, including 62% who had seen the A to Z vaping ad campaign. Around 3/4 of youth reported that their own or others' vaping had not affected their relationships in the past year. However, 20% reported that it had negatively impacted their relationships, and 5% reported that it had positively affected their relationships. Youth who had vaped were more likely than those who had never vaped to report vaping had affected their relationships, both negatively and positively. Youth who had vaped commonly described that vaping had negatively impacted their relationships because it put a strain on their friendships, while other youth described that it positively impacted their relationships because it provided a sense of community and allowed them to bond with others.
When asked what they thought about their school's vaping policies, under half of youth felt their school's vaping policies were well communicated to students, and fewer felt they were effective in preventing vaping and were balanced with support and education for students. Youth were asked an open-ended question about what schools could do to address vaping in the bathrooms. In general, students felt schools needed to have clearer policies around vaping and to enforce them consistently. Some students, mainly those who did not vape, listed specific consequences they felt could be enforced if students were caught vaping in the bathrooms. For example, confiscating the vapes. Another suggestion from those who vaped and those who did not was that schools should have a separate designated area where youth could go to vape or smoke. Some students felt that if youth were caught vaping, school staff should have conversations with them and try to understand why they vaped and offer support and resources. Youth offered a range of suggestions in response to an open-ended question about how schools could best support students to stop or reduce their vaping. Many youth expressed that it would be helpful to have vaping-related education and information integrated into the school curriculum through discussions, projects, and creative youth engagement initiatives. Students felt vaping education could be more effective if young people who had previously vaped shared their personal stories about the harms they experienced from vaping. Youth who want to stop or reduce their vaping should have access to supports and resources to do so, such as counseling to address the underlying issues and offer alternatives to vaping. There should also be safe spaces at school where youth can talk about their vaping, create goals, and keep each other accountable. Youth emphasize that interventions should come from a place of empathy, compassion, and non-judgment. Supports could also incorporate harm reduction principles and meet youth where they're at and be low barrier.
To wrap up this presentation, we want to share some of our recommendations from what we saw in the data for how youth could be better supported. We want to highlight the importance of understanding why youth might be vaping or using nicotine pouches, as we think doing this could help youth with reducing or stopping their use of these products. We think that understanding the reasons youth might use different substances, such as vaping and nicotine pouches, could help youth who do not use these products to be more compassionate towards their peers who do use them. Education and support from an early age is also important. If there could be age-appropriate education about vaping that starts in middle school, this could help support youth to make more informed choices. It is also important to offer support and solutions regarding how youth could stop or reduce their use if they feel ready to do so. For example, the A to Z vaping campaign, which was successful in sharing information about the harms of vaping, could be extended to include supports and solutions for youth who want to quit or reduce their vaping. A support group for youth specific to vaping and or nicotine pouch use could also be beneficial. Youth who previously used vapes and or nicotine pouches could share their stories of how they stopped or reduced their use and could act as role models and support their peers in this area. Any group involving these peer supports could also be overseen by a responsible adult. There could also be an online option for youth who would prefer to stay anonymous. Youth need internal motivation to feel ready to stop or reduce their use of vaping and or nicotine pouches. Otherwise, their attempts to quit may not be successful. However, alongside internal motivation, external motivation could also be helpful. For example, there could be an app for youth to set and track their goals. The app could include reminders that encourage youth to take part in healthy alternatives to vaping and or nicotine pouches, as well as games to incentivize youth to stop or reduce their use of these products.
And finally, just a few specific recommendations for schools. Schools could offer more interactive and engaging sessions about vaping and or nicotine pouches. They could invite youth who have previously used these products to discuss their experiences and reasons for quitting, as opposed to only offering presentations by adults. While big school assemblies are a good way to get lots of information out to big groups, smaller group discussions may be a better format to engage in deeper discussions. Posting information about vaping and nicotine pouch resources on online platforms like Google Classrooms and Teams and in bathroom stalls could help youth access them more privately. Such resources should also be available in the counselor's office. We hope that schools can use these survey findings to facilitate non-judgmental discussions about vaping and nicotine pouches and create an understanding and compassionate school environment for all students. Thanks for listening! For more information or to download the report, please visit the McCreary website at www.mcs.bc.ca or email the Executive Director, Annie Smith, at annie@mcs.bc.ca.